I'm going to be doing a implant exchange case here, meaning patients had a breast augmentation in the past. There's a couple of things that she wants to correct. Number one, she would like to be a little bit bigger. Number two, her cleavage. Number three is she does have some capsule that's a little bit thick around both of her implants, so we're going to remove the capsule. And then we're going to do something called a capsular. And what that is that's kind of reshaping the capsule, the inside. So let me show you what I mean.
Behind the mask. The more you know, the better you look. Behind the mask.
Here's the midline. This is right in her breastbone, okay? Here's her breastbone. Now she naturally has a fairly wide sternum, and so that gives her a fairly wide gap for having potential cleavage, because we can't put an implant anywhere in this territory. We can't put an implant on top of the breastbone. So we can only keep the implant underneath the breast. But the problem is, now when she lays down, the implant is way over here in this level. Here's the edge of the implant where I've got this dotted line. But now if I just manually take my hand and I just squeeze the implant and pinch her skin, so now you can see that she can have cleavage come all the way up to where she has her breast. I can't squeeze the implant or put the implant past this line here. What I'm going to do is I'm going to reshape the pocket so that I'm going to tighten the pocket. It's also a little bit low, so I'm going to bring the implant up. I'm going to do all of this by placing sutures on the inside, and I'm going to stitch all of this here too. And I'm going to do something called a popcorn capsular, and I'm going to show you what that's like. It's inside the pocket where I'm going to take her capsule that's here and I'm going to heat it up with the cautery, and it's going to kind of burst like a popcorn kernel. And by doing that, we're tightening this tissue and we're creating a little bit of scar tissue over here that's going to help maintain the implant in this more what we call medial position, going to the middle. So she doesn't remember exactly what her CCs are in her saline implant. And with saline implant, it doesn't really matter exactly what the size of the implant is itself. What's important is how much saline was put in. And sometimes people overinflate the implants. So you may have a 350 cc implant, but it gets inflated to 450 cc's. So what I do is when I remove the implant, we're going to weigh it on a scale. And that'll tell us exactly the size of the implant, how much water is there. I'm going to be doing something a little bit different than what I normally do. So normally if I'm operating on the breast, I always go make an incision here. She has had her implants, her initial implants, placed through an incision around the areola. So quite often I'll just reuse the periareolar incision if they have one already here and not put a new scar. And sometimes I have to put a new scar in this location, but I think in her situation, I'm going to be able to do everything that I need to do through this incision here. Okay, so here we're doing another implant exchange. This is for a different reason, but there's some things that are kind of similar and some things that are different. She wants to obviously change her implants because this one is deflated. That's her main reason. So right away you know that she's had saline implants because this breast is deflated. What happens when you have a saline implant is the implant will break, and then that saline just gets reabsorbed by the body. And so it leaves a patient with one flat breast, and her implant over here, her saline implant over here, is still intact. I think her breasts look really good. She's had 3 children since she's had her breast augmentation, and she doesn't need a lift. So this is just, a really good example. Everybody has different tissue. Everybody responds differently to pregnancy, and she's had 3 children and she doesn't need a lift. But since we're going to be here, she wants to have them a little bit bigger. We're going to do both sides. And we're going to do a little bit, just a small amount, of a popcorn capsulorrhaphy. You can see here she doesn't have as much movement of the implant to the outside as the previous patient I showed you. Her tissue is a little stronger. She hasn't really lost a ton of cleavage, but she's lost some. If you look at how I'm manipulating the implant. And so we want to really reestablish this cleavage here, and that's where the popcorn is going to come into effect. And the other case that I was showing you, I did a popcorn capsulorrhaphy where I superheated that tissue. I had to do it on the outside, and I had to do it on the inferior, the bottom part of the breast, to get the implant up a little bit. And then I also reinforced that repair with that capsulorrhaphy with stitches. I put more stitches in there as well. Today I don't need to do any stitches because her tissue is really good. If I don't have to do something, I don't do it. We try to do things, just that are absolutely needed. And so I think we're going to be fine just doing a popcorn, and that will reestablish her cleavage a little bit. It'll get the implant back where it was, and she's going to be a little bit bigger, and she's going to look just a little bit fresher. All right, let's get started.